What are the asset and income limits for Medicaid? Have you ever wondered how Medicaid determines who qualifies for its health coverage? Understanding the asset and income limits is essential for those seeking assistance. Medicaid is a government program aimed at providing health coverage to low-income individuals and families. It plays a vital role in addressing health disparities and inequality by ensuring access to health care for vulnerable populations. Let's break down the asset limits first. Asset limits refer to the maximum amount of resources an individual or couple can have to qualify for Medicaid. These assets include bank accounts, stocks, bonds, and other items that can be easily converted into cash. However, some assets, like a primary vehicle and personal items, are usually exempt from these limits. For a single applicant, the asset limit is generally set at $2,000. This means that if you are applying for Medicaid as an individual, you cannot have more than this amount in countable assets. The monthly income limit can vary by state, but it often hovers around $2,900. Now, if you are applying as a married couple, the rules change a bit. The asset limit for both spouses applying together is typically higher, often around $3,000 to $4,000. If only one spouse applies, that spouse can still have $2,000 in assets. The non-applicant spouse, however, can retain a larger amount, which can be up to $157,920, thanks to the Community Spouse Resource Allowance. There are also special cases to consider. Individuals with disabilities or those who are eligible for both Medicare and Medicaid may face different income and asset limits. For example, qualified disabled working individuals can often have income limits that go up to 200% of the federal poverty level. Understanding these limits is crucial, especially in the context of social stratification and inequality. Medicaid serves as a safety net for those who cannot afford health care otherwise. By knowing the asset and income limits, individuals can better navigate the system and ensure they qualify for the coverage they need. This is particularly important for low-income families and seniors who relying heavily on Medicaid for their healthcare needs. In summary, Medicaid plays a critical role in mitigating health disparities by providing access to health care for those who need it most. However, the eligibility criteria can sometimes create barriers, highlighting broader issues of inequality and access to health care within society.